The views and opinions expressed by the following program and its participants are solely their current opinions and do not reflect the opinions of BOBO 89.1 FM and DMS Broadcasting respective stations. The program participants' opinions are based upon information they consider reliable and based on their knowledge.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Once again, folks, thank you so much for tuning in. It's Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and we bring to you all things related to your health. Compliments our friends over there at the HSA. And this time, we're going to be talking about something that you probably haven't heard of pretty often, and that's neurology. Now, you've heard a lot of the sciences, but I wanted to talk a little bit to someone who is in the know. Dr. Thomas is here, and he's going to tell us a little bit about what neurology is and how it has basically expanded our thoughts in medicine and in the verge of helping us understand better ourselves. Good morning, Dr. Thomas.
Good morning. Good morning. How are you?
I'm good. So let me ask you this, doctor. In a layman's term, what is neurology?
Neurology is a field of medicine that deals with diseases of the nervous system, including the brain, the spinal cord, the peripheral nerves, and the muscles.
Okay. And this really is kind of the backbone because everything kind of flows into your neurons and your synapses. And realistically, you deal with a lot of the impulses that people have dealing with. I've heard people say, I'm going to a neurology specialist to help me. How on a daily lifestyle this can be helpful?
Yes, so neurology deals both with inpatients and outpatients. We mainly manage patients who have a structural disease of the nervous system, not so much addiction and mental health issues. That's
right.
A bit different. Usually I see patients with stroke, epilepsy, Parkinson's disease. So diseases that greatly affect people's
daily
health, lives, quality of life, their family's life, obviously, and their environment. So it can be challenging sometimes, but to me, that's the most beautiful field of medicine.
And just by hearing you talk about it, I can tell that there is definitely a passion there. And like I say to all my guests, tell me how you got into the field. What's your passion? What drives you in the field of medicine?
So when I went to high school and we started learning about the human body, the only thing I didn't understand at all was the nervous system. It was so complicated. It was very complex, interesting. And I thought to myself, okay, I want to know more. So I was also interested in biochemistry and the other biological sciences. But the human body and specifically the nervous system was the thing that blew my mind, really.
Exactly.
So I went to med school, and I'm originally from Hungary. So I did all my training there. I got a very good training there. And then when it was time to choose a specialty, I knew what I wanted. And that was neurology.
And neurology.
Yeah.
Okay.
Yeah.
So I just was listening and heard someone out in the hallway. What is the difference between neurology and neurosurgery? I was about to say neuroscience, but neurology and neurosurgery. Is there a difference there?
Yes. So both belong to neuroscience, as you said. Basically, the main difference is that we do not operate patients. So the surgeons do the operations. So if someone has a brain tumor or some prolapsed disc and they need surgery, that's neurosurgery. If the patient has a disease of the nervous system that can be treated with medications, that belongs to neurology. And usually we also do the majority of diagnostics.
Okay.
So we work up the patient, and then obviously we work really close together with the neurosurgeons. So sometimes the line is not that obvious, but the main difference is that they live their lives in the theater. Yeah, in the theater. Yes,
right.
yes.
And so realistically, if someone has an issue, they see you first.
Correct.
To start the process.
That is correct.
Before they get into the theater or need to get into the theater. You
Correct.
say, okay, we're taking a look at this. This is a potential problem, or this is a problem. We can fix it by doing this.
Exactly. So just an example, if someone presents with an epileptic seizure, and God forbid they have an abnormality in the brain that needs to be resected, I will see the patient, I will do all the necessary diagnostic workup, including imaging and other tests. I start the patient on a medication to prevent further seizure activity, and then I refer the patient to the neurosurgeon, and then we discuss the case, and if appropriate, they do a surgery to remove the abnormality.
Wow. So realistically, you are kind of the first line of defense to start the process and understanding based off of that. Wow. Okay. Excellent. Folks, we're going to take our first break. Thank you so much for tuning in. We're talking here to Dr. Thomas. He is the neurological doctor there from the HSA. And folks, bear with me. These are new terms that I'm getting used to. So if you hear me fumble a little bit, I will refer back to the general on hand with the information. So stick and stay. You're tuned into Healthcare Today with the HSA. I'm your host, Chuck Taylor. We'll be back in 2 minutes.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. And as I said, we're talking with Dr. Thomas. This is about all things related to your health, compliments of our friends over there at the HSA. Now, he was giving us a little bit about his background and how he got into the neurological scene, and also the difference between neurology and neurosurgeons. And a lot of us lay people will kind of, as the doc said, see it as one, but it's very distinctive and different based on that. So what are some of the scenarios that you can put us in, some of the types of conditions that neurologists would deal with? I mean, we're in Cayman, so what are some of the primary things that our local people have to deal with here?
And so far, the majority of patients I've seen were struggling with stroke. I've seen many stroke cases already, and I was actually a bit surprised how common stroke is on the island.
Okay.
And of course, I've seen many other patients, including patients with headache, dizziness, epilepsy, Parkinson's disease, what else? Neuropathy.
Pause. What is neuropathy?
So neuropathy is an umbrella term for every disease that affects the so-called peripheral nervous system. Most commonly, the symptoms are numbness and tingling in the feet. That can be painful even. It can be associated with weakness of the feet as well. It can spread to the hands. And the most common cause is diabetes, which again is extremely common in the Cayman Islands. Again, I was pretty struck by that.
And if we can just take a sidebar there for a second, I think this has been one of the higher scenarios of health issues I've seen in the Caribbean over the last 20 plus years. We locally call it sugar, but most people know it as that term. But diabetics on a whole has been just phenomenally on the increase here. I don't know if it's due to the culture of the food or the cooking or what. But genetics could be also, but I've seen it in probably more so in people heading into the late 40s. People that I've known, me personally, to know have been very healthy people all of their lives. Then 45, 50, I hear, hey, I've been diagnosed with, this type 2 or, early
Yes.
stages of it,
Yeah.
and even some as late as type 1. So, if you're listening in the sound of our voice, folks, please, please, please go ahead and get yourself checked out. Always, at least once every 2 years, make sure you do a complete baseline of all of this. Whether it's prostate for men, whether it's diabetic, you have to be proactive with your health, and that way we can catch these types of things early on. Just a sidebar there, doctor.
I totally agree, Chuck, and thank you very much for that. I to think that it's better to go to the appropriate screening, to the blood tests, etc. Because if I'm the first person you see, that means you had a stroke. That's too late.
Right.
So our aim is, as physicians, is to prevent these events, stroke specifically. And the only way to do that is if you look after yourself. You check your blood pressure, you go to the screening of diabetes, cholesterol, you eat a healthy diet, and you do regular physical exercise. You don't smoke. Like when you see a cigarette, just throw it away or run away. That's like incredibly unhealthy. So these lifestyle measures, without any medication even, can reduce stroke risk and heart attack risk very, very significantly.
Okay, let me ask you this, Doc. So a person who is diabetic, can they experience stroke also?
Yes, so diabetes in itself is a risk factor for stroke. It doubles the risk of
Really?
stroke.
Doubles it completely?
Yes,
Wow.
yes. And hypertension, high blood pressure, which, as you know, very commonly is associated with diabetes, is also increases the risk of stroke and cardiovascular disease.
Wow. And folks, these are things that we hear in our region very common. I've heard, young people in their mid-20s with hypertension, high blood pressure. And I think to myself, at 25, 26, high blood pressure, it makes me think, you are in for a long health problems if you don't change what you're doing, or even sometimes it may be hereditary. You have to change and be susceptible to the idea that, hey, my family has a history of this. I need to doubly make sure that I don't do these factors, drinking excessively, smoking, things of that nature, drugs, whatever it is, you need to be aware of it because you are already open to succumb to it. So why open the door more, as they would say?
Exactly. And there are genetic risk factors for stroke as well, and high blood pressure and diabetes. But again, that should prompt the individual to be even more aware of their own health and how to prevent.
it.
Yes.
We're talking today with neurologist Dr. Thomas. What are some of the other conditions? You said stroke, and I mean, we spend a little bit more time on it, and I hope to come back to it because as we start getting into the warmer part of the year, stroke levels seem to go up higher rather than the cooler months of the year. So I'd like to revisit that. But what are some of the other conditions that a neurologist deals with?
I see many patients with epilepsy. I see many patients with what we call neurodegenerative diseases. That's a big umbrella term for diseases that cause your brain cells to die for some reason. For instance, Alzheimer's disease or Parkinson's disease, Huntington's disease, ALS, motor neuron disease. Right, I'm sure you heard of it. A Lou Gehrig's disease.
Lou Gehrig's, yeah. The
famous baseball player. Yeah. So I see those as well. I see, meningitis, which is an infection of the brain, and many more, multiple sclerosis, autoimmune diseases that affect the nervous system. And as I said earlier, neuropathies, for instance, diabetic neuropathy, and muscular dystrophies as well.
So one of the things I really want to us to talk a little bit more about the specialty areas. I mean, we hear, I guess, because the world is such a communicative place now. We hear all these different terms, and people get kind of, I guess, stuck on certain things, especially with our region. What would you say we should focus in? If someone's listening, say, hey, you know what, I want to be a part of the solution. What should we be focusing on to help lower these problems that we're talking about?
So promoting brain health, I think, is very important. And it's not that hard. It's actually pretty easy. So, for instance, that we already discussed, avoiding excessive alcohol, avoiding smoking.
Completely.
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 And diet. So when we're talking about diet, we have ample evidence for the Mediterranean type diet, that's the best for prevention. That's a lot of fish, which is obviously easy here.
Yeah, easier here.
Reduced salt intake to reduce blood pressure. Too much salt intake can cause high blood pressure. Loads of raw, fresh fruits and veggies. And avoiding pastries and sweet beverages, moderate amount of dairy products, low fat, and of course physical exercise. So we recommend at least 30 to 40 minutes exercise, moderate intensity exercise. At least, I like to say every day, but at least realistically 4 or 5 times a week at least.
And I think, folks, these are things that are achievable naturally. And when I say naturally, you don't need to go to a doctor to eat better. Now, mind you, you may want to get some guidance, and that's great, and I think that's a good thing. But if you just heard what he said, everything that he said just a few minutes ago is achievable on our own. It's just we need to start the process and continue on to it. And I think, you know what, folks, I know we've just entered into a new year, and a lot of our New Year's resolutions have probably been tossed aside. Usually I say if we made it to the end of February, we got a habit.
Yes.
But we got to keep at it, folks. So just listen closely. Eat better. I know we fall off the bandwagon in our region and our culture. We try eating, and this is just you can blame me, try eating without salt for 1 month, and you'll see the difference it makes.
Yes. Interestingly, some of the salt we take in, it's not the actual salt we put in our food, but it's in the so-called ultra-processed foods. So it's already in the food that's pre-prepared for us. So I mean, like junk food, like hamburgers and pizza and all that stuff. It's packed with salt. So we have to choose very wisely what we eat, because even before we prepare the meal,
it's already got salt into it.
Exactly, it's already full of salt and other conservatives. So definitely avoid junk food.
and folks, and once again, the reality is, start a little bit. You don't run a mile by running a mile. You start by a few steps.
Exactly.
You start moving towards that direction. I think if you are committed to it, and sometimes your health is the goal. Sometimes your health is the reason why we're doing things. Limit things, reduce things, and eventually cut it out completely. I mean, one of the things that I'd like to focus in is a healthier Cayman. That's the reason why we have these talks each and every Friday. Thank you, HSA, and all of the doctors and the neurologist now that has stopped by here for having this conversation. Folks, we're going to take another quick break as we almost get halfway through it. We're going to come back and talk to Dr. Thomas about some specialties, some specialists that he worked with as a neurologist, and also the complexity of the field. He's making it sound simple, but I just looked up some of the things that they do, and this is a lot of work that is involved in his specific field. So we'll take 2 minutes and come right back.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor, sitting down on a beautiful Friday here. I know you've had a short work week with Valentine's Day and, of course, Ash Wednesday all rolled into one. I'm here with Dr. Thomas. He's a neurologist specialist over at the HSA. We're talking about what is neurology, and it's a big term, doctor. It encompasses a lot.
It is.
And what are some of the other specialties that roll into it under the umbrella? I talked about the neurosurgeons and stuff like that, but just give me a little bit wider look at it.
So we work closely together with many other specialties. If you think about the brain and what's close to the brain, you get the ear. So we work closely together with the ear, nose, throat specialists, especially in the field of dizziness, huge field, second most common symptom that patients go to doctor
Really?
with.
I would have not thought that.
Extremely common. And problems can come from the inner ear, problems can come from the brain, problems can come from the heart. So it's a very complex matter. So we work closely together with our great ENT team at HSA.
Wow, that's great, Doc. I wanted to ask you a little bit about this, new trends. And when I say new trends, talking about the new idea of gene therapy that we were talking about. And if you could just give me a little broad view about that, Doc, from how vast we've gotten and where we're going, hopefully, coming from.
So gene therapy is an evolving field. We're really at the early stages at this point. But where we are today and where we will be in 10 years, at this point, it's unimaginable. Because 10 years ago, I wouldn't have thought that we would be here today treating patients with genetic disease with gene therapy. So this is a really interesting time for neurology. And not just gene therapy, we have many other new interesting treatment options. We have new treatment options for intractable headaches, migraines that we never had before. We have new therapies.
Sorry to interrupt, Doc. So is migraines a huge concern? I mean, is it if you had, say, 10 patients a week, how many of them you think would be, with that?
So migraine is a very interesting disease because migraine itself is not a life-threatening disease. And most people who have migraine, it's mild. So they take their paracetamol when they have the headache or ibuprofen and they are fine. There are the patients I see in the neurology clinic with migraine are what we call the chronic migraines. So these are people who have bad headaches at least 15 days a month.
15 days a month?
Yeah, or more. Some patients have it every single day. Just imagine that. So even though it's not a life-threatening disease, it destroys your quality of life. So we desperately need treatment for these patients. And in the HSA, we have the newest treatment options, including the so-called monoclonal antibodies, the CGRP monoclonal antibodies, which is an entirely new way of treating migraine. We have have you heard of Botox?
Yes, I've heard Botox before.
So Botox or botulinum toxin is essentially a nerve poison that is produced by a bacterium. But if you clean that poison and put it in an injection and use it for the right reasons and the right causes, it can cure disease.
Really?
Yes. So, for example, you take a patient with very, very bad migraine and you inject Botox, very small doses, into the muscles on the scalp, around the head, that reduces the increased muscle tension, and that reduces the pain.
Okay.
For 3 months, and then you have to do it again because the poison is out. Botox is very interesting because it's also used for other indications in neurology, and but it's very effective for migraine.
Really? And I've heard it used in the cosmetic sense for many, many years. You know, in the industry that I'm in, you know, it's all about looks and voice. You know, so I've heard it. You know, it's been a mainstay of many Hollywood. Yeah, I'll just use them as an example for moons, many, many moons.
Yes.
But to think that now on the medical front, it's actually able to do something
therapeutic.
That is therapeutic and also quantitative. This is something that the medical field is really looking at and saying, hey, the numbers show this. That's incredible.
Exactly. And as I said, Botox is a nerve poison that essentially paralyzes the muscles for a couple of months. And the reason why the Hollywood stars use it to get rid of wrinkles is the same. So they inject the muscles on the so-called muscles of the facial expression.
Okay.
And it kind of smoothens out the wrinkles.
Okay.
Transiently, not forever.
Yeah, not forever.
But that's the cosmetic use. But we can use it for many different diseases, and one of the most common indication is chronic migraine.
Wow. It seems like neurology is, the field of it is moving fast.
Oh, very fast.
And the medical technology is moving along with it to see. It's really some of the innovations and some exciting ones. You were talking to me earlier from the ENT standpoint, the inner ear and the outer ear.
Yes.
Tell me a little bit more about that.
So, as I said, dizziness is an extremely common problem. And it all, when you break it down, so balance is extremely complicated. So the way that you can stand and you don't fall to your side is regulated by many, many structures in your body. And one of the structures in your body that helps you to keep your balance is the inner ear. And if there is a disease of the inner ear, that can lead you to lose balance and start to feel dizzy. But that's not the only cause that can cause balance issues and dizziness. Your central nervous system, your brain, is also very important in keeping your balance on many, many levels. So if there is an abnormality in the cerebellum, it's the back of the brain, that's the center of coordination, you will become you will have problems with coordination, you will have problems with balance, you will have problems with dizziness, but that obviously is a completely different matter than the inner ear problems. So this is why we work together to try to figure out what we call a central dizziness or peripheral dizziness. So does the symptom come from the brain or does it come from the inner ear? There are fancy ways to tell, and then obviously the therapy is based on the diagnosis.
Okay. And folks, you know, I always say, you know, as we get older, you know, people always talk about, you know, not being centered when they're standing and having issues with that. So it's always, you know, as our society gets older, I like to have those types of conversations because there's someone listening out there who may have an issue and it may be an inner ear issue. You know, they're always needing help standing up and actually feeling like they're being tilted forward or backwards.
Yes.
These are issues and things that they should go see the professional, their GP about, and they can do. Speaking of that, do you take referrals?
Yes. So we take referrals from physicians. So GP can refer you to my clinic if they feel that you have a neurological problem or if you feel. And we also, of course, take referrals from different specialties. So I see a lot of patients from the ENT colleagues, from the neurosurgeon colleagues, from the psychiatry colleagues, from the internal medicine colleagues. So these are the two main
main
ways.
avenues.
Avenues, yeah.
And which brings me to one of my questions before I take the break. Well, what I'll probably do is I'll ask the question and then we'll take the break and come back. The question is, how best can we educate the public to understand and support people with neurological disorders? Because most times, unless it's something that you specifically know, or your family is relating to it, you've never heard of these. How can we educate the public about that? I'm going to take a quick break. I'm here talking with Dr. Thomas from the HSA. He's a neurological physician over there. We're going to take a quick break, 2 minutes, and come right back.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to another episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday at 1 p.m. we get together and we talk about all things related to your health. And today I have with us Dr. Thomas. He's a neurologist, physician over at the HSA. And we're talking about right now about how best to educate the public to understand individuals with neurological disorders, and also kind of how to spot them early. Things kind of start at home before we go see our GP or we have a concern, especially whether it's infants or even, the elderly or maybe yourself. How can we educate them better, doctor?
So yeah, I've been thinking about this a lot actually, because as I said, I see a lot of stroke patients here, and one of the most striking thing was that how long do patients wait before they go to the doctor? So as I'm sure you've heard this before, when you have a stroke, when you develop symptoms of stroke, you need to get to A&E straight away. You can't wait. You don't wait for the GP. You don't wait for your friends or the neighbor. Straight away to A&E, because time is brain. So, and there are many campaigns in the US and in the UK of what we call the FAST, which is essentially the FAST campaign. The FAST stands for facial weakness, arm weakness, and speech problems, and the T is time to go to the hospital.
Okay.
So these campaigns aim to educate the public that what to do in certain situations. So for instance, in this case, when they develop a stroke. But of course, there are many other channels we can educate the public. For instance, this radio show, among others. In the internet, also there are very good online materials. I prefer to give online materials myself to the patients with a specific disease.
Right.
Because there is so much information on the internet, and for a layman, it is impossible to tell which is real and which is not, and what to follow. You can get confused easily if you just type in Parkinson's disease, okay? So there are very good online sources as well. And yes, education from, primary school about what we already discussed, including diet, regular physical exercise. So essentially it starts in childhood. Right,
exactly. And I think you brought in a really good segue here, Doctor, about time. Certain things are very time related. You need to take a look at it. If all of a sudden part of your face you're slurring and you're talking, but you feel like you can't feel your face or your arms, stroke, heart attack. These are things that are very time-related illnesses.
Time critical.
Time critical. Yeah, that's the word I'm looking for. Time critical, and you need to immediately seek medical attention and qualify. Cayman, we always. And I use my family, my elders, the gentlemen in my vicinity. they despise going to the hospital, the doctor. Oh, why are you taking me? It was just a slight pain that I had in my, that means that there's something wrong, folks. Sometimes you have to fight with us as men, to get us to do certain things, ladies, family, but it's in our best interest. And have conversations like this prior to when you will need it. So, it's almost a kind of preempting. As we get older, we will have problems. It's just natural. We don't know what it can be, but there will be something in the future that, know what your blood type is. Know how to get, to your nearest doctor, or have a doctor that you can call, or a physician, or even the HSA. Know the number. Sometimes people will be like, I don't know the number for the hospital.
Yes.
Yes. That's right down the street. So think proactively, Cayman. Think proactively so that we don't have to go through these issues in the future. As we were talking, Doc, I wanted to kind of start wrapping up. And preventative measures, we started talking about that earlier. Let's reiterate some of those things, preventative measures that people can do to promote good neurological health.
So the most important thing is, or things are what we call the lifestyle measures. Those were the simple things that we were talking about that anybody can do. You don't need a doctor for that. And it can prevent significant future problems.
Mm-hmm.
And these include regular physical exercise and losing weight if you're obese, a healthy diet, including the Mediterranean diet, and no smoking, minimal to no alcohol consumption. And what people don't talk a lot about is how important mental health is in preventing physical diseases.
Okay.
So we call these psychosocial factors. So for instance, stress at home or even poverty. These are actually risk factors for stroke.
Really?
Yeah.
Okay.
So, and cardiovascular disease in general. So we have to take into account that some people, through none of their own faults, are in a very difficult situation in their lives, in the crisis, and that's when they get the stroke or the heart attack. And this is why we also need to involve mental health, and that's a very, very important part of prevention.
There's a direct connection between your neurological condition and your state of mental health.
Exactly. Yeah. I know. I see that all the time. Yeah.
Exactly.
Yeah. When there's a stressful situation at work, the patient with migraine who had 3 headaches a month now has 13 headaches a month. It's a clear cut, direct. It's very direct. Yes,
exactly.
Yes,
and folks, so if you're listening to us, and I always try to give you food for thought. Do a mental health assessment of yourself. Look at some of the things that make you happy, what makes you sad, some triggers, and also also take a look at your diet. Look at what you're eating, what's your intake, what are you doing, and I always stress this, folks, and I'm guilty of it. Drink water. We live in one of the hottest regions of the world.
Oh yeah.
And I remember, they used to say, oh well, it was, I didn't want to drink too much water because it made me bloated and stuff like that. No, water is essential for you. Also, think of it, your brain is starving for water, and it's overheating. Your body's overheating. These things lead to your body breaking down.
Yes, and try to avoid sweetened beverages.
Sweet beverages.
Because it's sugar, and it's a disaster.
It's sugar with a bullet tied to it.
Exactly.
Correct. It's really,
it's poison, essentially.
Yeah, it's really, and we're always somewhat guilty of it, and we have to be mindful of it. I remember, and this is years ago, I remember when the internet, and folks, I'm dating myself, when the internet first came around, and people was like, oh, you know that you can literally take certain liquids and you can pour it on your car battery and it clean.
Yes.
And that was like the biggest thing, and they were showing how, and I was like, when you think of it, you thought it was fun and cool, but then think of that on your insides.
Exactly.
So someone pointed that out to me years ago. It was like, okay, imagine what that did to metal, what that does to you, who is flesh and blood, as they say.
Yes.
So be mindful of those things, folks.
And also, like, I don't want to seem like a person who's like very strict and who never drinks a glass of wine or never has a good burger.
Yeah.
Sometimes I'm guilty of that. So you can have a cheat day every now and then, but not like every day.
Yeah.
You can't eat pizza every day. I have patients who eat junk every day. Every day.
And here's the thing with that, Doc. And I say this, folks. These are choices that we have control of. We mind you, it may be hard control. It may get to the point that we have to, some people are more prone to obesity. Some people are more prone to certain things. So you are gravitated to this. If you realize that you're having a sugary snack at 4 a.m, 6 a.m, 8 a.m, 10, 12. You're having something like that 12 times a day. Then that's going to affect you. There's no one in the world, no doctor, and not even a person like me could say that's okay. That is you slowly demising yourself, and we don't want that.
Sure.
We definitely don't want that. And as I said, things in moderation, understanding it, and make healthier choices across the board.
Yes.
Across the board. Doc, it's a great talking to you. Before we wrap up, I'm going to take a last break, and you come back and you wrap up the day with us and tell us your thoughts of the future with your industry and also with the healthcare system. All right? We'll take 2 minutes and come right back. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. I'm here with Dr. Thomas, a neurology specialist over at the HSA. We'll be right back.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Once again, thank you so much for tuning in. This is Healthcare Today with the HSA. I'm your host, Chuck Taylor. As we get set to wrap up another intuitive hour, I have with me Dr. Thomas here from the HSA. He is a neurology specialist over there. Specialist or physician? Which one is?
Both are correct.
Both are correct. Yeah. Okay, all right. I didn't want to mislead your title.
No, that's fine.
So wrapping up, the floor is yours. Talk to us.
So I think the take-home message is you can prevent neurological disease to some extent, specifically stroke. We talked a lot about that. Mm-hmm. And you should want to prevent. Trust me, you want to prevent having a stroke. And you have a choice. And the other thing is, if you have a problem, ask for help. If you have a mental health problem, there's still some stigma around it. Mm-hmm. That people don't want to go to the mental health specialists. And I can tell you, they are the nicest people, like psychologists. I've never met a rude psychologist. Like, it's their job to be nice to you.
Yes.
So they are super cool people, and we have an excellent team here at HSA. And also, if you have a neurological problem, so the aforementioned stroke, epilepsy, etc., again, ask for help, and my colleagues and I are more than happy to help you.
Excellent. All right, Doc, thank you so much for sitting down, having a conversation with us today. You've been listening to Dr. Thomas. He is a neurology physician over at HSA. And once again, folks, as I say each and every time before I get out of here, be good to yourself. Take care of yourself. This is the only one you got. You only got one chance, and you are in control of that. Thank you so much. We'll talk again with you. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Have a good weekend.
Thank you very much, Chuck. Thank you.
Thank you.